And healthcare providers are also now working to get those vaccines to their patients and workers. Joining me now for more on that is Alan Levine, the president of Ballad Health, a hospital system that serves areas of Tennessee, North Carolina, Virginia, and Kentucky. Alan, thank you for being here. Talk us through a little bit of the logistics behind the scenes that are going on right now. When do you expect to get the vaccine there, and who will be the first people in your health system to get it?
Well, Diane, thank you and good morning. Actually, as I stand here talking to you, the first truck is pulling up to our hospital in Abingdon, Virginia, Johnston Memorial Hospital. And here a heroic nurse named Emily Boucher is going to be the first nurse to receive that vaccine just a few hours from now. I intend to be there with her when she takes the vaccine. The logistics of this is incredible. You know, the combination of the federal government, the military, private industry, getting the vaccines from research to injectable in this amount of time is pretty amazing. And as we heard Dr. Fauci say earlier, not at the sacrifice of quality or efficacy. This is a very highly effective vaccine. And
I know your hospital system serves several rural areas. We've heard that healthcare can be a little bit more difficult to access in some of those parts. Are you finding that there are some extra challenges with trying to get the vaccine to some of the more rural areas that you serve?
Well, it definitely adds a challenge when we're covering two different states in terms of distribution. Our system spans 2 states, 29 counties. So, yeah, we've got 2 hub hospitals in Southwest Virginia and 3 hub hospitals in Northeast Tennessee. Those hospitals will serve as the hub. We have the freezers there. We started preparing for this weeks and weeks ago. So we're prepared for it. The minute we receive the vaccine, there's a lot of logistics that went into this, everything from reprogramming our computer systems to be able to track who's received the first shot so that we can get the right people in to get, whether it's the Pfizer vaccine or the Moderna vaccine, to make sure that they get the right vaccine the second time. A lot of logistics. We have a whole emergency operations team and a sub-team that's been working on vaccine distribution for over a couple of months now.
And you've said some of the people that you serve have told Ballad Health employees that they don't believe COVID is real. So how are you fighting against this kind of virus disinformation? And do you worry that people in your area will hesitate to take the vaccine for that reason?
We are concerned about that. And it's been somewhat surprising, particularly to our nursing and physician teams. We've been out there really trying to lean in heavily to communicate and educate the community about how real the effects of this virus are. Look, we just had our all-time high number of new cases just this last Saturday for the week, almost 6,000 new cases. Our inpatients now with COVID are at an all-time high, and we're seeing an all-time high number of deaths. Last week it was nearly 80 alone. Or I should say almost 100 just last week alone, deaths. And these aren't just deaths. These are people that struggle and really suffer in the final hours of their lives. And so our nurses and our doctors have really asked us to lean forward and educate the public. And we've been doing that. And yeah, it's been a two-front war for sure.
So you talked about this a little bit, but this week the Appalachian Highlands region broke its single-day new case record. Hospitalizations are up, deaths are up. So how worried are you about your hospitals reaching capacity, especially given the holidays?
Well, we're grateful to serve the entire region of the Appalachian Highlands, and we've focused almost every day on making sure we have the capacity. We believe, based on our modeling, we could see as many as 350 to 550 patients in the next 3 weeks. We obviously are concerned about that. The limitation is staffing. As you know, this is happening all over the country, and we're no different. So yeah, staffing and the limits of our ability to serve the population here really relate back to the fact that our nurses and doctors have been at this for 10 months. They keep showing up. God bless them, and thankfully they are, and they're real heroes. We're going to continue to have their backs and hopefully get this vaccine distributed as quickly as possible so that we can stabilize and start to see a reduction in cases.
And Alan, do you feel that your health system is getting the support that you need from state leaders, federal leaders, local leaders?
Absolutely. Governor Lee, Governor in Tennessee, Governor Northam in Virginia, no matter what party they're from, they have leaned in very heavily. We're in communication with them almost every day. Look, this is I use the example of fog of war. As you went into this thing, we didn't know what we were dealing with, and a lot of very difficult decisions have to be made without a lot of vetted or confirmed information. And yet every day we hear from them inquiring about what's going on and what they can do to help us. We're grateful for that. And we're just going to continue to focus on the needs of our region.
Glad to hear it. Alan Levine, it's a large undertaking. We appreciate the work that you and all of your employees there are doing. Thank you. And thank you for your time today.
Thank you, Diane. God bless.
Same to you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.